We all make mistakes, but when a healthcare worker, such as a doctor, a surgeon, a pharmacist, or a nurse, makes a mistake, it can have detrimental and catastrophic consequences. The reason is because patients' lives are at stake. It's a known fact that mistakes do and will continue to happen, unfortunately. That's why it's important that we fundamentally transform the way we think about and the way we approach errors. Integrating and applying the methods that were previously mentioned are important to improve patient outcomes. Evidence-based practice is frequently used to deal with problematic areas in healthcare, such as this topic, errors. Evidence-based practice provides useful insight into previously tested and researched methods. First of all, we need to fix systems. There needs to be measures in place so that when a mistake happens, it doesn't adversely affect patients. For example, in order to prevent medication errors, hospitals and organizations can build effective systems to avoid a wrong medication reaching a patient. What needs to be integrated is maintaining adequate pharmacist and nurse staffing, and also integrating or implementing appropriate technology. Technology alone does not guarantee medication safety. It's also important the nurse's workflow. It's an important factor to ensure medication safety during administration, but implementing appropriate technology such as scanners will be helpful to prevent errors. The other important issue to mention is admitting error. When mistakes are disclosed after they occur and there is transparency and the errors are admitted, these errors can be addressed and also corrected more effectively, because if they're hidden, then they're bound to occur again and again. There is an article called Productive Errors: Transforming Learning Experiences in Healthcare. It's by Sandra Warner, who talks about how a nurse leader should address medical errors. It also describes how this nurse, as a transformational leader, should create a just culture. This concept about just culture promotes system improvements to prevent errors instead of blaming and punishing those who make errors. The nurse leader must also create and maintain a culture where the staff feels safe by reporting mistakes, because without that transparency, issues cannot be identified and fixed.